How do tumor suppressor genes impact leukemia molecular testing? Imagine your body's cells as a well-organized community, with each cell following rules to keep everything running smoothly. Tumor suppressor genes are like the community's safety inspectors, making sure cells don't grow out of control. In leukemia, which is a cancer of the blood and bone marrow, these genes play a crucial role in how the disease develops and how doctors understand it through molecular testing. Tumor suppressor genes such as TP53, PTN, and CUX1 act as brakes on cell growth. When these genes are working properly, they help prevent abnormal cell division. But if these genes are mutated, deleted, or turned off by epigenetic changes, their protective functions are lost. This loss allows leukemic cells to grow unchecked, leading to disease progression. For example, mutations in the TP53 gene are common in certain types of leukemia, like acute myeloid leukemia, and are linked to worse outcomes and resistance to chemotherapy. Similarly, the loss of PTN can promote the growth of T-cell acute lymphoblastic leukemia by disrupting cell survival pathways. Molecular testing in leukemia involves examining the genetic makeup of the cancer cells to find these alterations. Tests can detect mutations or deletions in tumor suppressor genes, assess changes in gene expression, or identify epigenetic modifications that turn off these genes. Sometimes, even if the gene itself isn't mutated, its function can be impaired through other mechanisms, and advanced testing helps reveal these hidden issues. Knowing whether tumor suppressor genes are altered helps doctors classify the type of leukemia and predict how aggressive it might be. For instance, the presence of TP53 mutations often indicates a more aggressive disease with a poorer prognosis. Detecting PTN loss in TAL can suggest a faster disease course, guiding doctors to choose more intensive or targeted treatments. The status of these genes also influences how leukemia responds to therapy. When tumor suppressor functions are lost, leukemic cells may become resistant to standard treatments because they evade programmed cell death or apoptosis. Molecular testing allows clinicians to identify these changes early, so they can consider alternative therapies or experimental options that might restore some of these protective pathways or target downstream effects. Modern molecular testing panels for leukemia routinely include genes like TP53 and PTN. Techniques such as next-generation sequencing, fluorescence in situ hybridization, and PCR-based tests are used to find mutations, deletions, or regulatory region changes. These detailed analyses provide a comprehensive picture of the disease at the molecular level. In summary, tumor suppressor genes are vital in understanding leukemia through molecular testing. They help define the disease, predict its behavior, and guide personalized treatment plans. By analyzing these genes, doctors gain valuable insights into the biology of leukemia, which ultimately supports better patient care. Always remember, if you or someone you know is dealing with leukemia, consulting a healthcare professional is essential for personalized advice and treatment options.